If you're making over $100,000, there are three important things to be aware of when it comes to your Medicare decision. Because in your situation, you're likely going to have some money. You don't want to kind of drain yourself dry for silly Medicare mistakes. So in this video, let's cover what those three things are so that you can make your right decision to both have great healthcare, but also protect your financial retirement savings. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both the Medicare rules of the system, but also all the insurance company options to, again, let you have the best health insurance while protecting you financially. And in the section below, I'm going to share some extra resources to help you more easily make your right Medicare decision. So let's hop into this. So again, if you're making over $100,000 as you head into retirement, there are three important things to be aware of. And as I mentioned before, these are important to you because most of you have savings and you don't want to drain your entire savings for Medicare mistakes. And so we want to do the right thing to, again, have that best healthcare, have those best providers while also protecting your savings. So step number one and tip number one is get really clear on when should you join Medicare. In many of your cases, if your income is high, you might end up delaying retirement until after 65. So Medicare rules say that you can delay Medicare past 65 as long as you're on an employer plan that meets Medicare rules. I covered what that means more in other videos, but my point is this. Your first number one thing is to get clear as to when to join Medicare. I have seen people who have higher incomes, who keep working, but they receive these scary letters from the government or from insurance companies, kind of enticing them into joining Medicare. And had they followed along with those guidances, they would have easily cost themselves over a couple $1,000s a year. So my point is, the step number one is when you have a high income, let's understand what your options are so that we can make an informed decision. Step number two is to get really clear, tip number two is to get really clear on which program is best for you. Now, if you have a very low income and you're on, say, Medicaid, Medicare Advantage can be a really good option. But for those people who tend to have a higher income, who tend to have a higher amount of savings, we tend to find that those people usually like to go on original Medicare with a Medicare supplement as well as a Part D plan. And the reason is that they tend to see the value in paying slightly higher premiums on original Medicare, but understanding that they have a lower total out-of-pocket costs, and they also have more versatility for doctors. They also tend to have lower denial rates and things like that. So what I find is when people have a higher income or have higher savings and they go on Advantage, if they get in a situation where they want to see a doctor and they can't see it, they're more frequently having to decide, do they get the care out of pocket that could cost them and their family a lot of money? Or do they just stick with the in-network provider? So my point is this, usually when you're on original Medicare, you have access to more providers, you have better coverage, less denials, things like that, which can then better protect you financially. Now, if you have no money, then it doesn't really matter. But again, most of you do have savings that we want to protect. And so getting that right program right is very, very important. Number three is to understand that Medicare does have income penalties. And what that means is that Medicare will look at your income from 2 years ago to determine what you pay for both Medicare Part B as well as Medicare Part D coverage. So if your income is over around $106,000 filing taxes as an individual, or over around $210,000 filing as a couple, you will pay more for Medicare. Now, there are ways that we can ask Medicare to reduce them or eliminate them. But the point is, having a higher income, there are extra costs as well as rules to be aware of, so you're not completely overpaying for your Medicare coverage. So if you have these higher incomes, there are some unique factors that impact you because, again, most of you want to be able to use your money for things like vacations and hobbies and not just paying for medical bills. And so it's really important to get Medicare right when you first join so that you do have that best healthcare to protect you financially, and we can, again, protect your savings for a lot more fun things than for medical benefits. Again, I'm Emily with the Medicare Coach, here to help you through your Medicare decision. Medicare can be great when you do what's right and best for you. So here's to helping you easily make your right Medicare decision.